The period of self-isolation for people who've had contact with those who've tested positive for coronavirus is to be cut from 14 to 10 days. The new rules, which already apply in Wales, take effect in the rest of the UK on Monday. The change will also apply to travellers quarantining after returning from abroad. The news came as data showed the number of coronavirus cases falling across most of England and Northern Ireland, but increasing in Wales, London and the east of England. Here's our health editor, Hugh Pym.
Contact tracing in action here in Peterborough. Local authorities staff going door to door to find people who've been recent contacts of those who test positive. They're following up after initial attempts by the National Test and Trace Service.
The numbers that they've obviously been given, they can't contact them on, so we just have to make that final call to their house.
Oh, hello, I'm calling from Peterborough.
For those contacted by the tracers, there's better news. They won't have to self-isolate for so long after a review by health officials of scientific studies.
All of those combined together show that the tail end of infectiousness, if you like, is the one where an individual's least likely to transmit infection. So allowing somebody out of self-isolation a short time earlier than that is a reasonable balance between managing the risk to the public but allowing us not to intrude on their lives.
The self-isolation period will come down from 14 days to 10. That already happens in Wales. It'll apply to contacts of those testing positive and people coming into the UK and needing to quarantine. It'll take effect on Monday, though if someone's already started a 14-day isolation, it'll now be 10. If the R number is above 1, it shows the virus is accelerating. Today's update shows it's just below 1, though back where it was 2 weeks ago, suggesting no clear trend, though there are variations around the UK. The latest survey of community infections by the Office for National Statistics suggests that in England, 1 in 115 people had the virus last week, with case rates coming down in most areas, though they were on the increase in London and the east of England. In Wales, it was 1 in 120 with the virus, with increases in recent weeks. In Scotland, it was also 1 in 120, with case rates relatively stable. In Northern Ireland, 1 in 235 had the virus, with continued declines in case rates. In areas of southeast England, case numbers are rising fastest amongst 11 to 18-year-olds. At this school in Dagenham, the teacher's on her own in the classroom, with pupils learning remotely. In northeast London and parts of Kent and Essex, secondary school pupils will be tested, with the virus causing havoc for the management of schools.
We've got to rejuggle cover. Cases are coming in for children who then need to isolate and be sent home. So it's a real challenge. Every day is a COVID day at the school at the moment.
In Birmingham, meanwhile, COVID marshals are patrolling the streets, reminding people that social distancing rules are as important as ever and that the virus is still a threat. Hugh Pym, BBC News.
As vaccines against coronavirus start to be rolled out, there remains an urgent need to find treatments for patients with COVID-19, and scientists have been looking at genetics as a way forward. A new study published in the journal Nature today looked at more than 2,000 patients in intensive care in the UK and identified specific genes that can be targeted, possibly by using treatments already in use for other diseases. Our science correspondent Rebecca Morell has more.
It's one of the pandemic's biggest puzzles, why some people with COVID have no symptoms and others get extremely ill. Now, one of the biggest studies of its kind has found possible answers in our DNA.
People who become desperately sick with any infection are genetically different from the rest of the population. What we're looking for are genes that tell us a bit of biological information that will enable us to come up with a better way of treating critical illness.
The scientists looked at the DNA of more than 2,000 COVID patients in intensive care. They scanned each person's genes, which contain the instructions for every biological process, including how to fight a virus. And they compared this with the DNA of healthy people to pinpoint any genetic differences. And they found one at a gene called TYK2. It activates parts of the immune response, but if that gene is faulty, the response can go into overdrive.
What's particularly exciting about the TYK2 finding is that there is already a whole class of drugs that inhibit that protein. So they target very specifically the biological mechanism that we think is causing severe COVID.
This means existing anti-inflammatory drugs, including one used for rheumatoid arthritis, could be tried. But it isn't the only genetic discovery. One gene helps to kickstart the immune system as soon as an infection is detected. Another plays a role in stopping the virus from making copies of itself. And it's revealing which treatments to use and also when to use them.
It really is an example of precision medicine where we can actually identify the moment at which things have gone awry in that individual. So knowing where the gene is in that response to infection gives us an idea of whether this is an early response or a late response and where we should be intervening.
Vaccines will decrease cases of COVID, but doctors around the world will be treating this disease for years to come. So new treatments are urgently needed, and these genetic discoveries could help in the race to find them. Rebecca Morrell, BBC News.